Hello, everyone. Thank you for joining us for COVID-19 in Latin America and the Caribbean, local innovations and solutions to combat the pandemic. We have a full agenda today, so we'll go ahead and get started right away. My name is Elaina Faust. I'm a graduate student in the Global Human Development Program at Georgetown University, and I'll be your moderator today. First, I would like to cover some quick logistics for use of the Zoom platform. So I want to let everyone know that we will be recording the session today for future distribution. I would also ask that everyone, if you are not presenting, remain on mute so that we can minimize background noise. And finally, let you know to please use the chat function on Zoom to pose your questions. And then we'll be having a Q&A portion at the end of the session. And we'll be covering as many of those questions as time allows. Next, we'll be hearing from Cesar Buenadicha. Dr. Buenadicha is Chief Discovery Officer at the Inter-American Development Bank, leading the Discovery Unit in the IDB Lab.
Thank you, Elena. Thank you, everyone. Ruth, if you can, share the screen. Thank you. It's very important to be here this morning and to have this opportunity with Georgetown to share the work that we're doing in Latin America in fighting this pandemic, which is the COVID-19. I believe that the work that we're doing is extremely relevant because, as we're going to see, Latin America is one of the regions in the world that has been hardest hit by the COVID-19, with over 3.5 million confirmed cases and over 150,000 deaths. So this is really a very serious situation. Latin America, early on with the crisis, had a difficult already situation, fiscal situation in many health systems, as we are going to see. So for us, as Inter-American Development Bank, it was a priority to work together with the governments of the region and also with entrepreneurs and the innovators to try to find opportunities and to try to bring practices and ideas of how we can support, a faster fight to the pandemic, Okay, Ruth, maybe next one. I want to briefly introduce to you who are we. We are the Inter-American Development Bank Group. We are the leading source of development finance for Latin America and the Caribbean. We have three entities in the group, just for you who don't know us. First one is the IDB itself, which is work with governments providing loans to support public policy and investments for development and for impact. We also have BidInvest, which is our private sector branch, which works, through private companies to support private investment in the region. And the third branch of the IDB is the place where Ruth, Houliston, and we work, which is the IDB Lab. We are the innovation lab of the IDB. We work in bringing together innovators and entrepreneurs and connecting them with the needs of the region, with new solutions, with new opportunities, so we can scale up those ideas and those solutions. Our goal as IDB Lab is to drive innovation for inclusions in Latin America and the Caribbean. I like this picture here because this is not just our motto. This is part of our goal here. And our logo as IDB Lab was designed by a person with disability, Sebastian, who is here. I don't know if you can see him. And we're very proud of supporting the part of innovation and diversity as key thematics around innovation and entrepreneurship iteration. We cannot have just innovation and entrepreneurship from some part of the population. We need to make innovation and entrepreneurship mainstream in the region, and everyone can work here. What we do is three things. The first one is we do, maybe Ruth, next one, the inclusion of vulnerable populations, as I was mentioning, with solutions that are market-driven, and we really want to achieve an impact that is transformative and can scale. This is really very ambitious, but we've been doing that for over 25 years, developing over $2 billion in over 2,400 projects all over the region with different partners from universities, entrepreneurs, startups, companies, public sector. This diversity of network and this capacity to really reach any place of the region with innovative solutions that have not been tested is one of our DNA more important traits. This is the experience that I was mentioning before, which really speaks for itself. And again, anything that you believe that this could be relevant for the audience here in terms of innovations for Latin America, please count with us as a partner of reference. I want to give the floor right now to Ruth Houliston, who has been leading the specific effort of identifying and supporting innovations to fight COVID-19 in the region as part of our work as IDB Lab. Ruth.
Thank you, Cesar. So in addition to our extensive experience across the region, we have over many years developed a strong network of innovation ecosystem players. And on the 16th of March this year, when we went into lockdown and work from home mode, I should say, and we still remain so to this day, we decided to respond to the situation and reach out to this substantial network of innovation ecosystem players to solicit proposals for a response to COVID. And within a period of 5 days, we received over 500 proposals that we then sorted, reviewed, evaluated, and within 2 weeks identified finalists. And I just want to sort of talk you through a little bit that process. Ultimately, we saw 10 key types of solutions coming from the market. And I think this is really important because not only were they geographically dispersed across all of our Latin America and Caribbean constituents, but they were also, you know, solutions offered, incredibly innovative solutions, locally developed, offered across these 10 solution types, from data tracking to digital communications, digital diagnosis, using big data, preparation and production of local medical devices, testing and diagnostic tools, preventative care, quarantine management, telemedicine, and triage. And it was really an incredible experience to see all of these proposals that came from the field. So we worked heavily to narrow down these 500 applications to a series of finalists that we then moved on to support. And we used a couple of criteria in addition to looking for geographical representation. We were very focused on ensuring that we were supporting products that had a very short period of time to market. So we were looking for innovations, we were looking for high impact, but we were also looking at the time to get to the market, because this is obviously the demand was necessary for that. At the same time, we were guided by the World Health Organization categorization of solution types, and we finally arrived at our 20 top finalists. And I have to say, this was an incredibly difficult challenge to narrow down these proposals. So whilst we are working closely with these finalists that offer solutions across the four categories of the WHO categorization, from detect, prevent, respond to recover, we were also very enthusiastic and happy to share and network the other applicants who didn't make this final cut to our broader network from partners in Facebook, Google, and otherwise, who are looking at supporting the innovation framework around COVID. And so we had narrowed down this 500 group to a smaller categorization. What was important for us as a development organization was to understand how this situation challenged us. It really made us realize that we had to be agile in responding to this situation with relevant financial products and offerings that were able to be supportive of this critical crisis situation. So on this occasion, we leveraged a new instrument that we piloted and placed in the market just last year. It's a prototype instrument that supports high-risk early-stage experimentation. It's rapidly executing, has a very short, a refined period of implementation over a maximum of 18 months, and focuses on 3 critical stages around the development and experimentation of an innovative technology solution or business model that has the potential for high impact. And those 3 stages center on defining the parameters for this experiment, who's involved and what specifically is going to be tested with what partners. And in the context of these solutions, this is a really important stage because there's a lot of interaction and engagement with public health. And so we, through this process, have also been able to leverage as an institution, as a group, our partners with the bank. As Cesar had indicated, that we have strong, the group represents a strong engagement with the government. And so we've worked very closely with our health specialists, who in turn have helped us to connect our tech solution providers to the public health system. And that's been a critical part of defining the parameters for these experiments. And then, of course, the implementation of the actual experiment is the critical piece of the project. And through that piece, there's a heavy emphasis on data tracking, because an experiment of this nature, without being able to evaluate it and disseminate that knowledge to potential scale partners, would be a real omission. And so data analysis throughout the experiment in order to create this evaluation is really critical. And we are very happy to have been able to mobilize this instrument and respond in an agile way to the demands. So today we have a very distinguished panel of health tech panelists, presenters from across our region. And I'd like to make a very quick introduction. We have colleagues from Argentina, from Casper Biotech, who will be presenting a diagnosis technology using CRISPR technology. We have colleagues from Colombia, who are a combination, a power team from the health tech InspiraMed with Ruta N, who is a leading innovation agency in Colombia. Together, they are supporting the implementation of this project, and we're joined today by one of the co-founders of InspiraMed. We also have with us from Ecuador another power team combining 2 agencies focused on developing a big data platform for contact tracing, Link Kin Analytics. And we have the duo presenting today, the CEOs from both Link and Kin Analytics. And of course, we have our partner in Jamaica, who is the founder and CEO of MDLink Limited, a telemedicine solution that combines insurance and delivery of medicine to high-risk populations. So without further ado, I will hand on to the health tech panelists and invite you to enjoy their story. Thank you very much.
All right, excellent. My name is Dr. Che Bowen. I am the CEO and founder of MDLink Limited. It's a healthcare startup. It was started in 2018, and it was the first, or is the first, and the largest telemedicine platform in the English-speaking Caribbean region. Again, we are in several countries, but our main focus with our partnership with IDB and IDB Lab is the COVID screening tool and telemedicine. So right now we're focused in Jamaica, and we do offer a variety of services, urgent care, medical advice. We have electronic medical records, and we are the COVID chatbot is what we're currently working on. We do have a prototype which I would be sharing with you in a quick look at how it would be working. We offer prescription refills as well as mental health therapy. We do teletriage. We offer second opinions, manage depression and addiction. We offer sick notes as well as lab testing, including COVID-19 testing. And we offer referral to specialists to ensure that we have an ecosystem. This shows the conditions that we are allowed to treat or that we manage via the telemedicine platform. And this also shows the specialists or the type of doctors that we have on the platform available. And the problem we're looking at with COVID-19, of course, is the global pandemic that we're faced with over 16,000 deaths globally. I believe it's continuing to increase. That number is continuing to increase. In Jamaica, our COVID-19 numbers as well are increasing, and we have opened the border to allow tourists in for the tourism economy to start rebuilding. And therefore, we are in the process of managing exactly how much we let in and keeping the curve down, focusing on keeping the curve and keeping the COVID-19 curve down. With the COVID-19 MDLink, as we call it, our chatbot, our teletriage solution, what we intend to do is focus on the vulnerable communities. Again, those are the elderly, the immunocompromised, persons with pre-existing medical conditions, persons with chronic conditions, the non-essential workers, and workers with salary cuts. So with the tourism industry going down, a lot of people are unemployed, and they right now fall into the vulnerable community. And so far, this is a look at our progress. We actually have 13,000 patients registered with us, 200 doctors, and our pharmacies are continuing to increase as well. This is an example of what the final COVID solution would look like for the website. Again, it would be on the website side and the app side, and it would allow patients to use it free of charge. The tool is free of charge. The main limiting factor would be access to internet access. And we have partnered with a telecommunications company that's Cable and Wireless, and we would be working on them to bring internet access to the vulnerable communities so that they can partake in this pilot or project in which we intend to, again, keep the COVID-19 pandemic controlled. So this is a list of partners we are currently partnered with and some that we would love to partner with, including the Ministry of Health and Wellness. We are partnered with insurance companies, Guardian Life, Sagicor, and Canopy to process any telemedicine visits throughout the region and in Jamaica. So again, how the MDLink COVID-19 project works is that you come on, you use the chatbot for free, you're teletriaged, you're screened, you answer some questions, and you're then, based on those symptoms, you are allowed to decide whether, well, we instruct you, we tell you what's next. We tell you whether or not you should go into the nearest testing facility, and we would know where you are located based on the questions asked, as well as GPS tagging. And we also allow the patient to use telemedicine at home if they are high risk. So again, you can speak with a doctor online, the MDLink platform. The doctor would advise you as to how you should manage your current symptoms, if you should stay at home, if you should be quarantined, if you need to have home testing done, if you should go to the nearest test center. So that's where telemedicine, again, would reassure the patient and help the patient know exactly where to go. In terms of the other conditions, we tailor the COVID-19 platform again to the Jamaican market. So it's specific to, the language we use, the patois we use, and the culture of the environment to make it more user-friendly. And again, it's free and available to the entire nation. Right, so we have a doctor portal and we have a patient portal. the doctors are allowed to set their own times and see the patients when they are available. They set their available appointment times. The communication is by text, audio, and video. And for the telemedicine aspect, you do have to pay. Again, we are partnering with insurance companies so that this is dramatically reduced and very affordable, as well as so we would be able to, again, process insurance and make the telemedicine aspect of this entire project very affordable. Again, increasing access to affordable healthcare is one of the MDLink mission statements. So again, this would benefit patients in a lot of ways. They would have access to the COVID tool wherever they are in Jamaica, and they would have access to treatment of any other conditions. If they don't have COVID-19, unless their symptoms pointed to something else, that can be managed by the telemedicine aspect of it. So we treat 90% of the most common symptoms. And I believe time is ticking, so I'm trying to go as quickly as possible. This shows how the MDLink project works. We have our AI tool. We triage the patient based on the CDC guideline questions that we're following. And again, the patient is advised on what to do next. If they're very low risk, they don't have to do anything. If they need to speak with a doctor for reassurance, they can do that online from the safety of their home. Again, keeping them safe, keeping the medical facilities and the medical practitioners safe if they do have COVID or COVID-19. And right, so our platform is very secure. We follow HIPAA guidelines, and we were developed on the Amazon Web Services platform. And what I want to show you is a quick look at what the tool would look like. I hope y'all can still see. So it's playing now, it's playing quickly, just 30 seconds. You answer a few questions. Questions are generated based on what you have answered. And again, the final report is shared to you at the end of all these questions. This tool is actually not available in the Caribbean, so it's good. It's a very good tool to launch in this COVID-19 times. And we are more or less, I would say, 90% finished. And we should be ready to launch within a week or so. That's it from me and MDLink for today.
Great, thank you so much, Dr. Bowen. All right, looks like maybe we'll hear then from Grupo Link. Do we have Juan Carlos or Andres?
Perfect. Good morning, everybody. Thank you very much for inviting us today. I got my master's degree from Georgetown, so it's very special for me to share our experience with this project. As you know, Ecuador has been one of the most affected countries in Latin America. On March 17th, my company, Link, specialized in the creation of digital ecosystems, and Andres Perez's company, Kin Analytics, specialized in advanced analytics, started to work together with the help of Endeavor on a georeferenced platform for big data analytics. And after only a few days of working side to side with the government officials, we realized that one of the most important issues was the fact that when people were confirmed as infected, they wouldn't remember the places they had attended during the last few days, and neither with whom. So along with Andres, we proposed the IDB Lab, the development of a contact tracing application to help solve this problem. With the help of the IDB, we chose DP3T technology as the base solution. And since then, our team has worked with engineers from Switzerland and Germany and the teams of Google and Apple in order to create the app named ASI, which as of this moment has been in a field test for 1 week with the help of the Ecuadorian National Police. My partner Andres is going to explain you how it works.
Okay, hi everybody. Thank you, Juan Carlos. So I'm Andres Perez from Kin Analytics, and I'm sure a lot of you are familiar with the concept of contact tracing, and you know, it's the process where you try to find what was the chain of of infections or potential infections through contacts in the past few days of a patient that has recently been tested or diagnosed with positive in any disease, right? And that's not the exception here. Typically, there has always been this manual or traditional process, or like either through a call center or interviewing a patient, trying to really rely on memory. And of course, that is quite important and still probably something that should continue to happen anyways. But in this new pandemic, really there has been a lot of new technologies, even because of the year we're in and everything. There's a lot of ways to support this process through a more advanced technology. And basically, I'm sure you're familiar with some of the options that came out around the world, like the Singapore contact tracing app was one of the first ones, and there were many different options, you know, centralized, non-centralized, and some that were a bit more protective of data privacies, other not so much. And we had the experience together with Juan Carlos and a lot of the people from government, even very high authorities like the Vice President, the Ministry of Health, and a lot of decision makers in trying to determine what was the best way to approach it. And really, I really think that's the IDB really helped us a lot in making sure that we followed the most strict data protocols. We're following GDPR data protection laws, even if they're not the reality in most of Latin America. The system is not centralized. We basically follow DP3T, right, which is a protocol that was developed by that has been adopted by most of the European Union, and I think we're quite proud of that, because and we're very soon about to launch it. We got the approval from Apple and Google, which is always some of the things that take a bit the longest. But I think today or tomorrow we will be launching the third largest city of Ecuador, and then in 1 or 2 more days launch to the entire public of Ecuador. And we're very proud because typically data protection and privacy is not the most prioritized aspect in the third world, and I think we were very good advocates in finding that middle ground where we do find a tool that helps in this contact tracing process, and that still protects the privacy of citizens, and that tries to adhere to the strictest laws of data privacy. So as very simply, we know how it works today in Ecuador. And each citizen can voluntarily, that's something very important already to say, voluntarily can decide to download or not an application that does not do any sort of a GPS tracking. We don't really care or need to know where you have been walking around. What the app is really doing is identifying the contacts through a Bluetooth devices on devices that have the same app, and saves these contacts through encryption, totally anonymous, and it saves them on the local phones, no centralization of the information. And then let's say, unfortunately, one of the people that was part of this contacts has a diagnosis of positive COVID, or is diagnosed positively through COVID through a test or through a doctor diagnosis. Then they have the option, again, it's option and voluntary, to tell the app, hey, I've been diagnosed positive. This information does not go to a government or to any centralized database. What it does is at that point, it tells the other users that had these contacts in the last days, hey, someone who we registered a contact with recently just confirmed that they were positive with COVID. So we recommend you follow steps A through Z or whatever, and we recommend you do the following. It's very voluntary. You can have the arguments that perhaps let's see how this voluntary and approach works in the third world. There's a lot of arguments against it, but to be honest, I think that's how you make things change. We start doing things like this. We're going to show you a short video that demonstrates the application, and there you have it. And basically, you can download it. It starts telling you, can you give us this permission? Download Bluetooth. It really helps you with battery optimization. It's not really invasive at all. It explains to you how it's going to be maintaining anonymity security and privacy of their information. Basically solid. It has a couple of questions that are used solely for the purposes of like medical triage and everything. It doesn't ask any private information. It asks things like, hey, what symptoms do you have? Where are you? So like once if you get the contact, it's gonna kind of like prioritize how to treat that patient. Not telling everyone, hey, go to a hospital directly, because that might be the first thing in terms of oversaturation. You can see it gives you the code is open source. Anyone, we have also done this project with a lot of like with an internal audit that is basically made up of like the top technical universities in Ecuador that are basically like making sure that data privacy is controlled, that everything is being followed as we say it is, you know. And while we're as a private entity helping out the government, the idea is to make sure that this application and solution is left to the government itself, so the Ministry of Health, and that's also part of our project to like give this transition. So
it's very important to mention that.
Apologies. Just to answer a couple of the questions, what issues do you expect from having the tracking program be largely voluntary? When these lead to large holes of missing information that could throw the entire path off? So a couple of things. One, yeah, I mean, some decision had to be made whether to make it voluntary or like obligate citizens. And to be honest, I ethically and for many reasons think it's better to do it voluntarily, also because we do expect a lot of people to do it. However, we do have a large pool of incentives. Okay, so basically we have a lot of advertisement. We have a lot of like the top 20 largest companies in Ecuador have said we want to help this. We're going to encourage our employees to use it. For example, in certain restaurants, they're going to give you like discounts or like or encourage that you have the application. So a lot of this more humane incentives, I say, rather than making obligatory. And yes, I mean, at the end of the day, no, it's not like if everyone doesn't have it, it doesn't work. If you're able to at least do some contacting already, it's going to go a long way to supporting this manual process, you know. So, but of course, we need people to download it and use it. And I think it's going to be an experiment, like almost everything in this new pandemic. And I'm sorry you couldn't hear me too well. If you have specific questions, please let me know.
Excuse me, Andres. It's important to mention that the app doesn't use data because the government made an agreement with the telecom companies. So that's a very good incentive for the people to download it. Thank you very much.
Thank you so much, both of you, for this presentation. Next, we're going to hear from Anselmo Rejardo with Casper Biotech.
Okay, hi everyone. I will go ahead and share my screen. Thank you for the introduction. My name is Anselmo Rejardo. I'm Director of Sales at Casper Biotech. Thank you for inviting us to this talk and share what we are doing with you. Casper Biotech is a startup founded in 2018 by an economist with experience in startup foundation and a group of scientists with extensive experience in CRISPR technology. We have a vision to create a new standard in molecular diagnostics. And for that, we are facing a challenge. Our mission is to change the current scenario in the molecular diagnostic field. Today, the molecular diagnostic field is mainly limited to centralized settings and to dependent on highly trained professionals. So what we are facing here is the situation, especially in this pandemic scenario, where time-critical conditions and time-critical results are really, really important. So Casper is developing diagnostic solutions that can be deployed to low resource settings or low complexity settings, making a huge impact in access to healthcare. All of our solutions are based on a technology of CRISPR, as you mentioned in the introduction. CRISPR is a technology that has been known for many years as a efficient tool for gene editing. But CRISPR has the potential to work as a machine that recognizes DNA or RNA sequences, and that makes an efficient tool as well for molecular diagnostics and the detection of viral infections, bacterial infections, genetic mutations, etc. So as we will see in a few slides, we have been focusing on solutions for the COVID-19 diagnostic, but Casper is developing, it's more than COVID-19. We are developing actually a platform that has the potential to work from any kind of samples and in a fast, affordable, and accurate manner obtain results for viral infections, for bacterial infections, detection of genetic mutations in the oncology field, and so on. As for now, we have developed two different solutions. One of our solutions is the LyoCRISPR kit, and the LyoCRISPR kit is a solution for high throughput testing and low complexity settings. And then another solution that we call the phantom point of care device that is applicable in the field where the patient is. Our first solution is the LyoCRISPR kit that has been submitted for FDA approval, and we are planning to have it available in the market in possibly the next 2 to 3 weeks. About the features of our kit, of the LyoCRISPR kit, it has a sensitivity and a specificity that is compatible to the gold standard qPCR methods. It's a method that is really user-friendly because it requires minimal intervention of the operator. It allows also high throughput testing. It means that it can process 96 patient samples in less than 60 minutes, and is also very affordable, and it works directly from sample. So you just take a patient swab and you can process that without any prior requirement for processing the sample. And the most important thing that makes this solution applicable to low resource settings and to the centralized settings is that it doesn't require any specialized instruments. So this is how the kit looks like. Our first solution, the Casper LyoCRISPR kit, is a kit for 96 reactions. It includes all the components, the controls to give an accurate result to the patient. And we have developed also a portable and very simple device where you can obtain the results. This device, in only 5 minutes, you just place into the device the patient samples, and you can get, for a positive result, a green spot, and for a negative result, you get like a black spot or an uncolored spot in the plate. So it's quite simple. The workflow is really fast, and this device does not require any kind of specialized training or calibration. And the second solution that we have is the phantom point of care device. As I mentioned, this is under development, and we are planning to have it available in the market by Q4 of this year. This phantom point of care device, as the name indicates, is a solution that could be deployable to in the field where the patient is in low resource settings. It's a reusable device. This is how the device looks like. It's a fully automated solution. In this solution, you just have to place the nasal swab from the patient, or that can be also self-collected by the patient. You place the swab into this device and you get the results, or you visualize the results in a smartphone application. So for this development, or to develop these solutions, we are partnering with many institutions, public and private institutions around the world, ministries of health, also very important private labs around the world that have been testing and validating our kits. And just to finish, this is our team. As I mentioned, our CEO is Franco Gautia. He's an economist with experience in a startup foundation. Then we have a scientist team that is very experienced in the CRISPR technology. And we have an engineering team that is working on the phantom point of care solution. So I think that's it. And thank you very much again for inviting us to this talk today.
Thank you very much, Anselmo, and to all of our presenters. We'll now be transitioning into the Q&A portion, so feel free to continue to pose questions via the chat, and then I will put them to our panelists. So the first one I think is appropriate for all of our panelists today, which was, how can you address limited internet access in some of the communities that you're hoping to reach?
All right, I can start with that one. This is Dr. Bowen from MDLink again. What we have done in that regard is we have partnered with the telecommunication companies, the internet providers in Jamaica, and they have in fact zero-rated the app for us. And what that means is you can download and use the app without a data plan. And we do intend to work with them to provide internet access to specific vulnerable areas so that they can, again, use the platform, the MDLink platform and COVID screening tool. Thank you.
Thank you, Dr. Bowen. Would any of our other panelists like to speak to that question? Okay. Well, we had another question in a similar vein, which was, what are the power requirements for each solution?
Okay, thank you for this question. It's a very good question. Depending on the solution, the Lyo CRISPR kit, that is a high throughput screening solution that requires this device that it is powered by the connection to a computer, okay, to a laptop. So it does not require actually a connection or to be plugged to an external outlet, electrical outlet. So just the computer is enough to run the solution.
Then it looks like we had a question specifically for Dr. Bowen, which was, do providers have access to patient histories? And if so, how is that information kept secure? And then also in relation to COVID-19, is the system set up for longer term patient monitoring?
Okay, those are good questions. To answer the first question, do providers have access to previous patient data? Again, we follow the HIPAA guidelines. So yes, they do have access provided that the patient allows them to have that access. And can you repeat the second question for me, please?
Absolutely. The second question was, in relation to COVID-19, is the system set up for longer term patient monitoring?
The entire MDLink system is definitely set up for a longer patient monitoring system. And we do suspect that, again, COVID-19 would not be something we're going to have to be living with. So it would be around for quite some time. And yes, the platform would be able to run even after this 18-month period. And it can transition into many other scenarios.
Great, thank you, Dr. Bowen. Looks like we have another question coming in through the chat. What is the expected uptake of the app ASI in Ecuador? What has been the uptake of similar apps in Europe?
Okay, so the expected uptake, to be honest, is I wish I had a better answer. We have done some surveys and a bit of experimentation, but it's tough because we're going to be one of the first countries in the region, and kind of like with following this structure of app in South America. So a bit like almost everything this pandemic is a bit unknown, unfortunately, and of course we're going to try to make it as much as we can. But Germany, I think, is the exemplary country in the world. Correct me if I'm wrong, Juan Carlos, but I think in the first week or two they already had like almost 5 to 10% of the population had downloaded some really exciting numbers. But to be honest, with very different populations, and of course we have to do as best as we can to incentivize the use of it.
Yeah, we're working with a very experienced communication group, and with the help with the of the IDB communication group as well. So we have great expectations of the usage of the app in our country.
Great, thank you. And I've just heard from Professor Johnson. It sounds like there's been some technical challenges, which is why some of our participants have ended up, it appears, in a different Zoom room. So I just wanted to apologize for that and let you all know that, again, we are recording this session and it will be available to anyone that was not able to attend. But that being said, we have a little bit of extra time for more questions, which is great. So it looks like we have another one in the chat. How are vital sign assessments made through the MedLink platform? Do patients have to go anywhere for that?
Correct, that's a good question. It's a digital solution and we do not use vital signs for the COVID screening tool. It's based on symptoms. That's how the assessment is made. And again, the conditions we treat on the telemedicine platform are conditions that do not require vital signs. And to further that, MDLink does plan to move into the remote patient monitoring aspect of telemedicine. But as it stands now, we don't have any remote patient monitoring, which is what would be needed to monitor patient vitals.
Thank you, Dr. Bowen. I guess I have a question I would love to pose to all of our panelists, which is that many countries have a complex digital health ecosystem and infrastructure established already. So could you all speak a little bit about how your solutions might be able to fit into those existing ecosystems and how they might be able to feed data into those systems or interoperate?
That's an excellent question. I'd want to answer it first and say that Jamaica does not have a digital health ecosystem at all. In fact, MDLink is probably the largest digital health ecosystem that Jamaica and the region has currently. So what we are hoping to do actually is I reached out to Ms. Terry Segri from Jamaica's IDB Lab, and she is assisting me to reach out to the IDB so that they can connect us with the Ministry of Health here in Jamaica, and we can work towards establishing a digital health ecosystem for Jamaica.
Excellent. Would any of our other panelists like to speak to that question? If not, we have another one coming in through the chat, which might be appropriate for some of our IDB representatives. This is, does IDB Lab support of these initiatives envision implementing these pilots in other member countries? So Ruth or Cesar, I'm not sure if you would maybe like to address that one.
Yes, so maybe a couple of things here. The first one is that this has been a specific effort around COVID-19 solutions for the pandemic, for the health pandemic. We are also working on different solutions for the economic reactivation of the economy. Sorry, I wanted to send this message before around tourism. So for instance, we are working around a challenge around tourism solutions for the Caribbean. Needless to say that Caribbean is gonna face a very difficult situation with the COVID-19 in terms of one of the key revenue sectors of the economy, which is tourism. So this is part of a broader response that we are doing of connecting innovation entrepreneurs with the needs around COVID-19. The second thing is we are developing a network of actors. These 4 solutions that we are presenting today, 3+1 that because of technical reasons was not presented, are part of a whole package of over 30, 40 solutions that we are developing. And we are gonna generate a network of these solutions together with the health sector of the IDB, so we can make sure that they scale and each other work together. The one in Ecuador, for instance, is already working, as mentioned, in El Salvador and other countries, because we believe that it's a great opportunity. I don't know, Ruth, you want to add something?
Thanks. I think just to say that you know, we've encouraged and are actively pursuing these kinds of connections across our various colleagues, through our various colleagues and country officers. And whilst we may not be on the direct front line of helping some of these initiatives to scale in every occasion, we are certainly you know, actively connecting the partners so that they have access to opportunities in other countries. Although we are also supporting, looking forward to supporting the scale up of some of these initiatives, which includes moving to bringing the technology solutions to other countries.
Great, well, we have time for a couple more questions, so please feel free to keep posing them in the chat. If not, I have another question I'd like to put forward, which is that, of course, now we're in sort of an emergency response to the COVID-19 pandemic, but in the future, you know, there are likely to be other pandemics that come down the road. So if any of our panelists would like to speak to the potential for their solution, maybe to adjust and accommodate other pandemics in the future, I would be very interested to hear about that.
Okay, this is Anselmo from Casper Biotech. Thank you for your question. I can say that from Casper, we are developing more than, in this case, a solution for to address the situation of COVID-19. But our solution, any one of them, the Lyo kit or the Phantom point of care, can be easily configured to address or to detect any kind or any different viral or bacterial infections. So the answer is yes. I mean, we are prepared to redesign our device in case a different situation is needed. It's a platform that is quite easily configured for detection of our different infectious diseases. So in fact, in our pipeline, we have been working on the design of a different kit for tropical viruses like dengue, Zika. So we have many solutions that we can deploy.
Thank you, Anselmo. Would anyone from MDLink or GroupoLink like to address that question?
Can you just run the question one more time for me, please?
Yes, absolutely. The question was, now we're primarily focused on emergency response to the COVID-19 pandemic as our largest challenge at hand, but how can your solution potentially be used in the future to address other diseases or other pandemics that might come about?
And sorry, I was on mute. Yeah, but yeah, absolutely. So the idea here, and as I was mentioning also before, you know, like we're helping the government develop this app and everything, but the idea is to make sure that it's a tool that's left as an ongoing tool for the Ministry of Health and honestly for any other organizations that might use it. The concept of contact tracing can be used in a number of other diseases that might come in the future for future outbreaks of the same one. So for sure, the idea is to not let this be just something COVID focused.
Right, and from the MDLink side of things, what we would hope to do is, or the plan for us is that we have a teletriage COVID screening tool, and that can easily be configured into an overall screening tool, so you can screen for any of the conditions, any sort of medical conditions, and two, we can be specific to any sort of global pandemic, any sort of screening that needs to be done. So that being said, as a teletriage solution, it would definitely be able to be implemented ongoing after these 18 months. It's something that we would definitely keep on the MDLink platform, as it's free, so it encourages patients to access and learn about their healthcare and be transitioned into telemedicine or in-office medicine if necessary. So that's how MDLink would continue to move forward even after the COVID-19 pandemic.
Great, thank you so much. Well, it looks like we are just coming up on time. I just wanted to thank all of our wonderful panelists again for presenting and sharing your knowledge with us today, as well as thanking our partners and co-sponsors of this event and our partners over at IDB. I just wanted to apologize again for some of the technical challenges that we were facing today, and thank you for bearing with us as we all navigate this sort of new virtual platform for sharing. And thank you everyone for listening in today and for your thoughtful questions. And we look forward to seeing you at future events.